Your discharge and early recovery. Before you are discharged from the hospital, your surgeon, medical doctor, physical therapist, nurse, case manager, social worker, and family will discuss the arrangements and plans and answer any questions you may have. More information is contained in the following sections. What medical information should I receive? Discharge summary. The hospital will write a discharge summary. This contains all of the relevant information about what happened to you and your treatment and recovery in the hospital. It will also list the medications you will need to take at home. The discharge summary will be sent to your PCP and you should be given a copy. If you are already being seen by specialists before your dissection, such as a cardiologist or vascular surgeon, they should also receive a copy of the discharge summary. Make sure the hospital is aware that they should be told. If you have any unanswered questions, perhaps see your notes on page 94 through 97. Ask to have them answered before you are discharged from the hospital. Follow-up appointments. Aortic dissection is a serious illness requiring lifelong follow-up. Before leaving the hospital, ask your medical team who will be responsible for your follow-up. In most cases, you will be asked initially to come back to see your surgeon or cardiologist. In the longer term, you may be handed over to another specialist, such as a cardiologist. Make sure that you understand and are happy with your follow-up plan before you leave the hospital. When you are discharged from the hospital, you will receive instructions regarding your medications and when your follow-up appointment with your surgeon will be scheduled. You may also be instructed to see your PCP and or cardiologist. This first appointment is an important one. Do not miss it. If you cannot attend on the date, call the hospital to make alternate arrangements. At your follow-up appointment, your surgeon will review your progress and advise you about long-term follow-up and monitoring you may need. Further treatment. In some cases, your aortic dissection will require further treatment. For example, if you've had surgery, it may not have been possible to repair all of your dissected aorta at once, and further surgery may be required. If you had a type B dissection, sometimes it is better to manage it medically initially, then consider surgery in a few months. Most patients require lifelong surveillance. Your surgeon will tell you whether you might need further treatment and what that might be. Regular CT or MRI scans enable the surgeon to see your aorta and decide what needs to be done and when. Any additional surgery would be carefully planned and may be open heart surgery or by endovascular treatment using a stent. Discharge medication and repeat prescriptions. As you leave the hospital, you should be given a prescription or prescriptions for the medication you will need to take at home. Your medical team should explain what these medications are and do, when to take them, and any side effects to look out for. Purchasing a daily pill dispenser is helpful to keep track of when to take your medication. There is also information within Part B of this patient guide. If you have any questions about medication, a pharmacist at the hospital or local pharmacy can help. Your discharge summary contains a list of the medications that your PCP should continue to prescribe for you. When you get home, make an appointment with your PCP to arrange for your repeat prescriptions. Ensure you discuss any concerns you have and plan with them for your long-term care. As an aortic dissection patient, you may need to see the PCP more frequently than you used to. Pain relief. Good pain control is essential for speedy recovery and to help you return to normal activities. When you leave the hospital, you may be given medication for pain relief. Take it at regular intervals as prescribed and before pain can build up. This is the key to successful pain control. The rule is don't wait for the pain. If you have had surgery, coughing or sneezing may be painful. If this happens, find a cushion or a rolled up towel and hold it firmly but carefully against your chest. When trying to sleep, you may find it helps to place a pillow where needed to get comfortable. After surgery, on your left side for a type B dissection, a pillow placed under your armpit and down the left side of your body may enable you to lie on that side comfortably. When you are feeling more comfortable, you can gradually reduce your pain relief medication. Aches and pains in your chest and shoulders may continue for some months after surgery, perhaps longer in the case of very extensive surgery. If there is any change in the nature and location of your pain, contact your PCP. Constipation. Constipation can occur following surgery or due to pain medications. To help prevent or resolve this, eat a well-balanced diet. AG with additional fruit and fiber and drink plenty of water. Keeping mobile and taking regular walks will also help. You may also be sent home with stool softeners. It is important that you not strain to have a bowel movement. Once you've been at home for a week, if you're still constipated, seek advice from your PCP. Wounds. If you have had open heart aortic surgery, you will have a wound in the middle of your chest. You may also have a wound in your groin or either side, and some patients will also have a wound near the collarbone. If you have had endovascular surgery, typically you will just have a wound in your groin. The nurses will tend to your wounds regularly until you leave the hospital. In general, they should heal without problems when you are home. You should be given instructions about how to care for your wounds and change the dressings. It is important to report to your doctor or nurse if you experience any redness, pain, or leakage from the wound so that this can be treated. It is possible for wounds to get infected, and this needs immediate treatment. You may have stitches or staples in your wounds or where your chest drains were secured. These are usually removed 7 to 10 days after your operation or by the time you are discharged from the hospital. Wash wounds with soap and water in the shower every day unless specifically told to apply other treatments. Advice on showering with your wounds is given on page 39. After 6 to 8 weeks and you have a mature scar formed over your wounds, you should protect it from the sun with a total block sunscreen. Gently rubbing in an unscented cream and massaging the area can help, but check with your surgeon first before applying anything to the surgical wound. Your scar may become thick, bumpy, and raised. Be patient and allow a year to pass because the scar will remodel and look significantly better over time. Complications. Not all aortic dissection patients experience complications, but some do. Complications include stroke, spinal cord injury, loss of voice, heart rhythm disturbance, temporary kidney failure, nerve issues, and/or wound infection. Such complications can extend your hospital stay. Treatment of any complications will be specific to you, and the detail is beyond the scope of this guide. However, some general advice is given below under long-term recovery on page 47. Ask your doctors about any complications you may have had before you leave the hospital and make sure you know how they will be treated.